Good morning, everyone. My topic is 1-year outcome of combined phacoemulsification and tanito microtrabeculotomy in open-angle glaucoma, a randomized controlled trial. I have no financial disclosure. Minimally invasive glaucoma surgeries are the modality which are ab interno, low risk, cost-effective, highly efficacious, and minimally traumatic. These are known to bridge the therapeutic gap between the pharmacotherapy and glaucoma filtering surgeries. Tanito microhook trabeculotomy comes under trabecular meshwork based MIGS procedures. It cleaves the trabecular meshwork and inner wall of Schlemm's canal under direct visualization, thus reducing the trabecular aqueous humor outflow. Coming to the surgical technique, after routine phacoemulsification, the microscope is tilted 30 to 45 degrees towards the surgeon and patient's head away from the surgeon. Swan-Jacob gonio lens is used for direct visualization, and viscoelastic is used as the coupling agent. Straight hook, right angled and left angled microhooks are used to incise to the adequate degree required. The aim of our study was to assess the early postoperative effectiveness and safety profile of ab interno microtrabeculotomy when combined with cataract surgery in patients with open-angle glaucoma. It was a prospective, randomized, interventional, hospital-based study which included 114 patients divided into two groups, Group 1 of microhook trabeculotomy with phacoemulsification and Group 2 of phacoemulsification alone. The inclusion criteria were age 40 to 70 years, primary open-angle glaucoma, pseudo-exfoliation glaucoma, ocular hypertension with visually significant cataract and wide open angles with mean deviation of less than 12 decibels. The exclusion criteria were any prior surgery, glaucoma or cataract surgery, angle closure, traumatic or neovascular glaucoma, any corneal inflammation or retinal pathology. Coming to the success criteria, complete success was considered when the intraocular pressure was less than equal to 21 mm of mercury with more than equal to 20% reduction from the baseline without the use of anti-glaucoma medication, and qualified success when anti-glaucoma medications were used. The failure was considered when intraocular pressure was more than 21 mm of mercury or less than 5 mm of mercury on 2 consecutive visits, and the performance or if any glaucoma surgery was done or vision threatening complications were observed. Additional criteria at intraocular pressure of less than equal to 18 mm of mercury and less than equal to 15 mm of mercury were taken. Coming to results, in both the groups, the baseline characteristics were comparable and there was significant increase in best corrected visual acuity in both the groups. The mean intraocular pressure reduction was significantly reduced in both the groups with more significant reduction in the phaco-microlot group from preoperative 26.45 to postoperative 12.45 mm of mercury. The intraocular spikes were seen more with the phacoemulsification group, and the anti-glaucoma medication load were decreased in both the groups with more reduction in the phaco-microlot group from preoperative AGM of 0.58 to postoperative 0.16 at 12 months. The complications were comparable in both the groups with 7% hyphema seen in the phaco-microlot group but which were managed conservatively, and one patient underwent AC wash. The Kaplan-Meier survival plot was made and complete success was better seen in the phaco-microlot group in the end of 1 year. Coming to discussion, why microlot trabeculotomy? It is a cost-effective technique which is less time-consuming and has a shorter learning curve. It can be easily combined with the cataract surgery, and being an instrument which can be reused after sterilization, it might be a good armamentarium for countries like India. There are studies which show similar results, but most of the studies are done outside India. Most of the studies are retrospective, observational studies. Unlike our prospective, interventional and randomized control study, there is limited literature on the efficacy of combined phacoemulsification and ab interno microtrabeculotomy, and to the best of our knowledge, this is the first prospective randomized study done on combined phacoemulsification with ab interno trabeculotomy in Indian population. To conclude, combined phacoemulsification with ab interno tanito microtrabeculotomy is an efficacious and safe procedure in patients with mild to moderate open-angle glaucoma. It significantly reduces intraocular pressure and improves the visual acuity in early postoperative period. It may be a valuable MIGS addition to the glaucoma surgical armamentarium. Thank you.
Thank you, Dr. DRISHTI. And how much is the follow-up period?
So 1 year.
1 year. And what is the dropout in the 1 year period?
Sir, there were 3 dropouts in the phaco microlot group, and phacoemulsification, sir, the dropouts were more with the year passing, because we were usually following up them for 6 months. After that, they usually stopped following up with us.
How
But
much did
after
you-
1 year, we would call them and ask them to come. The intraocular pressure was measured that time,
How
and
much
the
did
age
you,
was
how
taken.
much did you cut? 180 degrees?
So, sir, actually it was different according to the nasal angulation and the surgery. It was from 90 degrees till 270 degrees, and it was seen that the intraocular pressure reduction reduction was more with the degrees of trabeculotomy done, but it was not statistically significant.
That means 90 degrees worked as much as 270 degrees, you mean?
From 90 degrees in some patients to 270 degrees in some.
And the results are?
Sir, the results showed that intraocular pressure reduction was more with higher degree of incision, but the reduction was not statistically significant.
Okay.
So, one question, what is the basis for including OHT patients in this in these cases?
Sir,
Case
actually,
series. What is the basis, because you are dealing with open-angle glaucoma, what is the basis of including
yes, sir.
OHT cases also?
sir, the number of ocular hypertension glaucoma patients were only 2 in these cases, which were in that diagnostic dilemma for us. Like they had that yellowish on OCT early pre-perimetric changes, which had not developed to complete.
Since you, since you said this is cost effective, what is the difference in cost if you compare it with Bang?
Definitely, ma'am, Bang will be more cost effective, but this instrument is specifically made to target the trabecular meshwork. While Bang, we just needle we use, it is not specifically meant for trabecular meshwork, and the degree of incision is also
Thank you.
less. Although Bang would be more cost effective as compared to tanito.
Thank you.